would do another update because I have received my new phages. Yay! So I had been out of phages for 5 weeks, which was, I can say that was a little bit too long at this point for me. It wasn't too bad. The first 2 weeks, 2.5 weeks were great. No new flare-ups, no pain, no drainage. Yeah, it was fine. Energy, everything. But after 2.5 weeks I started noticing my energy dropping, joint pain coming back, stomach pain, nausea coming back. And after 3 weeks I got new inflammations. At first they were pretty severe, so I was up to about a 6 of pain level. Some wounds got back and opened up. And I was like, okay, well, the pain wasn't as bad as it was before I started phage therapy, but it was definitely inflamed, and I was definitely like feeling the fact that I was out of phages for so long. That took about 3 to 4 days, and then my pain decreased again. And it was like my body was attacking the inflammations on its own now. And I got less and less and less, and there were some inflammations, but they were hardly painful, not above a 3 again. So it was really interesting to see that even though I had like flares again, somehow my body then tackled that. So maybe there were still phages left, or I don't know what was happening in my body, but it was pretty new for me. But pretty interesting. So I have been into contact with the Eliava for getting new phages. I sent swabs. I showed you videos about how to take swabs, and then I sent them. They found 3 different kinds of bacteria in 3 different lesions. In one they found a Proteus mirabilis, which is a bacteria that is pretty commonly found with me. One was Staphylococcus epidermis, which is also a bacteria which pretty often is found with me. And another one was, I believe, the Pseudomonas. I'm not entirely sure anymore. But that's also a bacteria that's pretty often found with my lesions. So this is not something that is new to me. And it's interesting because that gives them a base on how to continue treatment. So their advice was to continue treatment as it was with the intestine and the staphylococci. And we added the PO to that, PO phage cocktails, because one of the staph epidermis that they found with me, mainly on a lesion on my back, only was sensitive in their lab results for the PO. So I asked them to add that one to see what that does to my lesions as well. So I received a package. A package they sent, most of the time they sent with FedEx, and we had to retrieve it from Belgium because the Dutch government destroys every kind of unregistered medication. The customs just destroys it, so it's a waste to send it to the Netherlands. So we found an address in Belgium, and we went to pick it up there. Or actually Robert did, my boyfriend did, he picked it up there. And it contained new phages. So again, the things that they added were the Staphylococcus phages, a few boxes of that, intestine phages, few boxes of that, also the PO phages, but it's not in the fridge I have here because I'm in my cabin. And my dad lives nearby, so the PO is in his fridge because I'm not taking it for the first cycle of this run. So they also sent staphylococcal cream and PO cream to alternate. So the new treatment they gave me was as followed. The first 15 days I will be taking intestine in the morning early, staphylococcal in the morning orally, and I will alternate the creams as where necessary. So on open flares or bumps that come up. So I just put the creams on the bandages basically. I will alternate those, and after that I will have a 2-week stop. So no phages, I can still use the creams, alternate the creams, but no oral phages. Then after those 2 weeks stop, I will do another run of 15 days, only that time I will take the intestine in the morning and the staphylococcal in the the PO in the evening. Sorry, the PO. So I will do 15 days of that and still can alternate the creams. And then I will do a 20-day stop again. At least that's the plan. And then I will do another run of intestine in the morning orally and staphylococcal in the evening orally. So and I can still use the creams to alternate. So this is the plan now. And we're going to see how that affects me, because the times that I'm taking phages is shorter and the times in between them is the same. So I'm pretty interesting to see that even if I take less phages, if the effect will still be the same and will still maintenance, lessening my pain and my flare-ups. So yeah, that's been pretty interesting. So I've started that on Thursday. And today it is Tuesday, so a few days already. So before I started this new phage cycle, I noticed a decrease in my energy. And as soon as I started to take phages again, within 2 days, I had my energy back. So this is one of the things that I noticed, okay, there is something happening. It is working somehow. We have to wait and see how much that takes on. The second thing I noticed that within 3 to 4 days, my wounds closed. So the drainage stopped and my wounds closed. So this is something I noticed before. As soon as I start taking phages, that wounds just close up. The drainage stops. This is something that I noticed before when I start taking phages. The second thing that happened is that I got a few more bumps under my skin. This happened the first time I took phages in Georgia as well. A few bumps, just like my body's kind of fighting against the fact that it's healing, which is pretty normal because somehow the inflammation reaction just wants to keep continuing. So, but those bumps, they are red and they are a little elevated, but they are not like having a big reddish spot, just only the spot itself. It's small, it's a little red, and it feels like a little bit like a bruise. It doesn't feel really painful. If I don't touch it, I don't feel it. Only if I put real pressure on it, then it feels like a bruise, basically. So the pain is none whatsoever, which is pretty interesting as well. So yeah, so far I already see some improvements, but I'm extremely interested to see what is going to happen as soon as I start taking the PO on the second course, because I never took PO before. I noticed the creams are working, but I never took PO orally, so I'm pretty interested and excited to see what is going to happen if I take that, and if I will see a difference in my skin. So this was my update on the new phages that I got in. Anybody who wants to pursue phage therapy and is watching my videos, the Eliava is sending phages to many countries, not every country, because again, some countries destroy it, but many countries they can send you phages to if you want to pursue distance treatment, or, and this is something that I always advise, you can go to the clinic. The Eliava hosts about 60 countries, patients of 60 countries. They have different kinds of interpreters. They do everything to try to help you as best as they can. They run every single test. So this is why I always advise people to go to the clinic. What I also noticed is the best way to go to the clinic is go via a patient advocate. I went via Lydia Bakhuis from Vagen, Georgia.nl, and Lydia Bakhuis, she's a patient advocate that really guides patients. If you need to know something about plane tickets, about where to stay if you go there, if you have a problem or don't understand something in communication with the Eliava, Lydia steps in and she will do her hardest, her very best to help you and to do the communication in your best interest. And this is something that is extremely important. The Eliava is in a different country. Things go differently there, and Lydia always somehow gets it done within a limited amount of time. And so if you go via a patient advocate, it's worth every cent, because, well, so far I have contacted Lydia about 40 or 50 times or something because I had a question or was trying to help another patient or something wasn't clear that was communicated by the Eliava, and she always figures it out. So if you try to pursue phage therapy, I will put the email in the bottom. Put an email with your medical problems, with your maybe some pictures if you have HS just like me, with some pictures in it. Explain what medication you're already taking and what you would like to do, a distance treatment or go to the clinic or something like that. Or if you need some information, you can email to this email address that I'm putting down below, and send Lydia an email and she will do her very best to help you get phage therapy. It is out of pocket. At this point, we are fighting for it to get it covered by insurance, to get it more accepted in normal medicine. But this is a fight that is going to take years because, well, laws need to change, there need to be money. The whole way of thinking in medicine needs to be changed to adapt phage therapy to patients. Even though the Eliava in Georgia has a lot of experience, in other countries they just don't. So it will take years before this will become available. And might even take like 15 to 20 years before it will really get widestream available and accepted as a treatment for thousands and thousands of patients. So if you want to pursue this now, if you don't want to wait 15 to 20 years, I can really recommend you to contact Lydia and take a distance or clinic treatment via the Eliava, which is, for me, it was an amazing experience. So this was my update, and I will keep continuing updating, vlogging, telling you guys about everything that we are doing, and we hope that phage therapy will be available sooner than is predicted now. So this is our goal, and if you have any questions, feel free to send me an email or comment under my videos. Well, talk to you guys soon. Bye everyone!